CIRCULATE-US study is building on the fact that ctDNA is a very powerful marker for minimal residual disease. And it's a very specific and sensitive marker for identifying microscopic or residual disease that we're unable to pick up with scans. And the existing data clearly show that patients, especially in multiple cancers, including colon cancer, without detectable ctDNA are at a much lower risk of recurrence, whereas those with detectable ctDNA are at a very high risk of developing recurrence. So CIRCULATE-US is a phase 2, phase 3 study that aims to enroll patients with stage 3 A/B colon cancer, as well as stage 2 and 3C patients who are ctDNA positive onto this trial, and it aims to enroll about 1,900 patients. And patients who are negative for ctDNA or MRD postoperatively using the Natera Signatera assay will be randomized to immediate adjuvant chemotherapy per established guidelines versus serial ctDNA monitoring. So in these patients who are ctDNA negative, we'll just be monitoring them with with serial ctDNA assays and starting chemotherapy if and when they turn positive versus starting chemotherapy immediately after surgery. In patients who are ctDNA positive after surgery, then the question we are asking is, could we improve outcomes by intensifying adjuvant chemotherapy? So in these patients, they may get current standard of care adjuvant chemotherapy with fluoropyrimidine, such as 5-FU or capecitabine with oxaliplatin, or they may get more intensive chemotherapy with the addition of irinotecan to 5-FU and oxaliplatin. So patients are randomized between standard of care versus more intensive adjuvant chemotherapy. And the primary objectives for patients who are ctDNA negative would be time to ctDNA positivity in the phase 2 portion and disease-free survival in the phase 3 portion. And in patients who are ctDNA positive, the primary endpoint of both phase 2 and phase 3 parts is disease-free survival. The trial will be activated in the next month or so, and will be open for enrollment throughout the country through the NCTN mechanism.